All right, well, thank everyone for calling in and logging in today. This is really just our March MBQIP webinar is just going to be updates and just going over what are the current measures, when are they due, and then spending some time talking about how EDTC has changed and how that'll be different in the coming submission. We also have a couple quality improvement opportunities towards the end of the presentation that we'll discuss as well. And as always, if you have any questions at all, please let me know. We're a small group. So the current measures and domains. So MBQIP is divided into 4 domains. Outpatient, so we have outpatient 2, 3, 18, and 22. We're starting to get a much smaller set of measures than we had a couple of years ago. Patient safety, we have it depends what you call it. It's HCP squared or IMM3, or it used to be called outpatient 27. It's the employee flu measure that is submitted to NHSN. And then antibiotic stewardship is also captured within patient safety. That is submitted in the form of the annual facility survey, also through NHSN. The other measure is ED2, which is abstracted through inpatient cart. And actually, the May 15th, so our next submission for that one, that'll be the very last submission. So it's quite possible we might not need inpatient cart after May 15th. I will definitely keep everyone posted to see what we hear. The third domain is patient engagement. That's our HCAP measures are all collectively in there. And then lastly, we have transfer communication. And that's the emergency department transfer communications data. Now it's measures 1 through 8 along with the composites. And I have several slides dedicated to that to talk about the differences there. So what are our upcoming deadlines for each of these? Outpatient 2, 3, and 18, which those are abstracted through outpatient cart. Those will be due on May 1st, 2020. Let me preface all of this by saying I reached out to Sarah Brinkman and Robin Carlson late last week. I shared the PowerPoint with them to get revisions and comments. I also asked, given what's going on right now, has CMS proposed, pushing the deadlines for these? And they have not heard of anything yet. And so that's something else that I'll stay on top of is if our deadlines do change. But right now, it's as they have been scheduled. So I will be sure and let everyone know if something does change. So those 3 outpatient measures that are abstracted through outpatient cart, that'll be for our 4th quarter 2019 encounters. Those are due May 1st, 2020. Outpatient 22, that one is only submitted once per year, and we're looking at January through December, and it's our total ED encounters and then our total who left without being seen. So it was left before they were evaluated by a medical professional, so a physician, a PA, nurse practitioner, whoever's covering your ED. It's not the same as AMA. I know folks sometimes get those two mixed up. And so that one is actually, it's not abstracted. You just log directly into QualityNet and put in your totals for the calendar year. That one is due on May 15th. I will be sending out a video and more information around May 1st. Since it's just a once per year measure, I don't know about you guys, but if I do something just once per year, I'm rusty in between. Patient safety deadlines. The employee flu measure, it's another one that's once per year. It's going to be due on May 15th as well. That's submitted directly into NHSN, and that's looking at the flu season. So it's 4th quarter 2019 and 1st quarter 2020, again, into NHSN. The annual facility survey, it was due on March 1st. But if your facility, say you're just getting signed up or just able to get logged into NHSN, go ahead and complete your annual facility survey. I know the federal office is wanting us to get them all kind of on the same schedule. It makes it easier for looking at reviewing the data, analyzing the data. But again, if you're just started in your role, you're just getting logged in, go ahead and get that data in for the previous calendar year. And then ED2, that is the only measure in inpatient cart, and it's due May 15th, 2020, and that's the last submission for it. Patient engagement, our HCAP, those are collected by a vendor at for our facility, and then they submit that on our behalf into QualityNet. So the 4th quarter 2019 encounters will be due April 1st, 2020. Transfer communications, that's the one that we send out the SurveyMonkey link for, and then we collect all the data within the state and send in a state spreadsheet. We will still open that survey link on April 1st, so next week, for the first quarter 2020 transfers. I will note that the specifications for those are different from the previous submissions. And again, I have several slides to talk about those. We get a lot of questions about what are the minimum reporting requirements. And over the past few years, the federal office has really encouraged us, as well as critical access hospitals, to report as many measures as possible, kind of inching towards 100% reporting of all critical access hospitals for all quarters on all measures. So the current requirements that started as of September 1st, 2019 are listed below. First things first, assign MOU from the hospital to submit and share MBQIP data. That's covered for all of our critical access hospitals. But largely it's report data on at least one measure for at least one quarter in at least 3 of the 4 quality domains. So those 4 domains I previously mentioned. Moving forward, starting September 1st, 2020, they're going to stick with reporting in at least 3 domains, but it's going to be for at least 2 quarters. If you recall, I mentioned a few of those measures are only reported once per year. Those will count for all 4 quarters. So antibiotic stewardship, that annual facility survey, that counts as reporting for all 4 quarters. The employee flu, reported once per year, and outpatient 22. So since those are only reported once, those are all considered all 4 quarters. Are there any questions so far? Alrighty, well, EDTC is different as of January 1st, 2020. And so I actually took some screenshots of the pages from the specifications guide to kind of walk through what are the differences. So talking about our population and sampling, largely the same as what we looked at before. I know one thing that kind of hung some folks up was nursing home. When we have a patient go back to the nursing home, that is still considered a transfer. That's still captured in here. I think one of the biggest changes was if we move a patient into observation. I want to say that might have been included last time, but it's now excluded from the sample this time, or moving forward, I should say. Our sample size requirement. So if you have 45 or fewer transfers out of your ED per quarter, you'll need to report on all of those transfers. If you have 46 or more than 45, you'll need to submit at least 45 records or report on those records. You know, you could report, if you recall, we've changed our form, and so now you can enter in your number instead of selecting the number. If you wanted to report on 100 per quarter, you definitely can. But if you do, say I want to stick to the 45 and you want to sample out those 45, you have to use uniform methodology. So your methodology that you select for this quarter needs to maintain the same throughout. One thing it cannot be is selecting our best cases per quarter. Probably one of the easiest methodologies, if you wanted to stick to 45, would be picking your first 15 per month. That's uniform, it's kind of easy to remember. And then, let's see, we will, I don't know if it's on this page or not, but there's still going to be the all EDT, or it used to be called all EDTC, but it's our number of records that we reviewed that meet all of the submeasures. And so I'll be going through the submeasures here. One thing that's different, it's not labeled EDTC 1, it's just measure 1. And if you recall from the previous specifications, these really are not falling in line. They were captured previously, but they're not necessarily lining up exactly to how we did this last time. So measure 1, home medications, and it's just making sure that we have documentation and listing of the medications the patient takes at home. And so we have notes for abstraction, and then also where to find some of this data, inclusions, complementary medications, and then over-the-counter medications, as well as prescriptions. Measure 2, allergies and or reactions, and that includes food, medication, which we are already capturing, selected data sources, the ED record and or the transfer summary. Measure 3, any type of medication that we gave the patient in the ED. And so we have the sources where you could find that data for that patient. And then measure 4, that's the ED provider note. And so, you know, why the patient's in the ED, history of present illness or condition, a focused physical exam, and then relevant chronic conditions for that patient. Measure 5, mental status orientation assessment. You know, is the patient alert, or they're oriented, or is there something else going on? And then also the places to find this data. Measure 6, why are we transferring that patient? Why are we needing to send that patient on to another facility? And then also the plan of care. And so the EMTALA form, their transfer summary, and their ED record are places to look for that. Measure 7, tests and or procedures performed. So anything that we tested or did with that patient in our facility, so labs, x-rays, EKGs, cultures, anything testing and or procedures that we did with that patient before sending them on. And then measure 8 is the results of the testing and or procedures. And so the list of places to find those, as well as what's included, as well as where to find those measures. So does anyone have any questions about the new measures, or I guess the new format of the measures? I think this is just my opinion as someone who's non-clinical and kind of sits on the outside, but it seems to me that they're a little bit more straightforward and easier to understand what's included this round. But again, if you guys have any questions at all, please let us know. I have updated our submission form, and I'll be sending that out so you guys can have a look at it before you log into SurveyMonkey. But again, please let me know if you have any questions, or we can clear something up for you. Here is the EDTC Resources page. They do have a data collection tool in Excel. This is a really good tool to kind of help walk through. It's one way to stay on top of your transfers throughout the quarter, but it's also kind of alleviates some of those questions of does this count or does this not count. Here's the web link down here of how to access this, as well as Robin did some specifications training, so she did a much better job of walking through those measures. And also the data specification guide is on here as well. All right, so moving on to some upcoming quality improvement opportunities. If you recall, I sent out a few emails about working with OpenQ to do a QI project where we're looking at having 2 virtual meetings. So the format would be virtual, in person, and then virtual. Here's what tentatively what we're looking at. And then also each facility will select one of these following measures to work on. A lot has changed in the past, well, a lot's changed in the past week, but a lot has changed since we initially sent these emails out. And so I have Donna on the call. Right now we're going to postpone this till maybe the summer, or when things kind of settle down a little bit in our facilities and in our area. But Donna, did you want to share anything?
Yes, it's a quality improvement project. We did one last year in the Northwest region of Oklahoma. It was a pilot project, and it went very well. And we're pleased to have this opportunity to bring it back again as a statewide. It's just these times are upon us, uncertain times, and we're going to have to postpone it. But if you haven't looked at it or heard about it, look into it and see if you would possibly want to join this summer when we get it started again.
Yes, and please disregard return by March 27th. Once we have another date and a better idea of the process moving forward, I will send out the new dates as well as the new deadline. And then the other thing we have is IHI Open School. We offered this last year, and we're looking to renew our subscription. For those who participated last year, though, if you want to say you wanted to do another certificate or do some more coursework, we will need you to complete another MOA, and you will have to get new login information as well. because we'll have a new group code and everything. But we are working on getting this up and running, and so I will send this out later, probably later in April. But it's just something to think about. Again, it's on demand. We had about 35 or so folks participate last time, and we've got a pretty good response from folks saying that they learned quite a bit and they found it useful. So we're looking to offer it again. So if you did participate last time and there's more coursework you want to do, absolutely, please sign up. Or if there's someone new in your facility, please share this with them if they'd like to participate. Lastly, abstracting for accuracy. This is with Robin Carlson at Stratus. Here are just some of the, just a brief overview of the information. From what I understand, sign up is an ongoing process, so there's not necessarily deadlines or cohorts to get in. From the hospitals that I know have worked on this, they have provided really great feedback. And so what you do is you abstract some of your records, you share those records with Robin, and then she abstracts them, and you guys compare and see, you know, what am I missing or how should I be doing this? So if you would like more information or if you'd like for me to put you in touch with Robin, I can definitely do that. And then lastly, we're always looking for webinar topics. So if you have ideas or if there's something you have questions about, please let us know. We will be on the lookout for topics, and I'll also, as soon as I see resources or updates, I'll be sure and share those. So does anyone have any questions or concerns?
A question. This is Patty in Kingfisher. At one time you talked about some quality measures for skill or swing bids. What's our process and what do we need to do to begin those measures?
For which measures, I'm sorry?
With swing bids.
With the swing bid? Let me check with Corey. I know we had talked about signing on. I'm not for sure if we completely got signed on to do that, but let me follow up on that as well.
Okay, thank you.
Are there any other questions? Well, thank everyone for your time and for logging on today. I know that there's a lot of uncertainty in our facilities and across our state, and so if there's anything that we can do to help, or if you have any questions at all, please feel free to reach out to us. And so thank you all, and you guys have a great rest of your day.